Hey there, it's Huang with Hand Therapy Secrets, and welcome to my show where I want to share with you different techniques, different people, and even tips that you can use right away in your therapy practice, right? So this episode is going to be talking to a good friend of mine. She is a physical therapist. Her name is Jessica, and she specializes in myofascial release. So stay tuned. You're going to hear a little bit more about how she works in her practice, how she works with OTs that specialize in the same thing she does, myofascial release, and share with you some tips that you can use right away with any of your patients. All right, enjoy the show.
Welcome. My name is Huang with the Hand Therapy Secrets. This is my good friend Jessica. Jessica, I'd love for you to introduce yourself to everyone who watches this. Majority of the time, people who are here watching Hand Therapy Secrets, they're occupational therapists, occupational therapist assistant, physical therapists as well. But everyone here has an interest in specializing in hand and upper extremity types of issues. But no matter what the background is, that they are really interested in upper extremity types of issues. So tell everyone a little bit about you and where you are and your company.
Yeah, absolutely. Thank you so much for having me on, Wong. It's a pleasure to be here. My name is Dr. Jessica Papa, and I'm a physical therapist, and I specialize in treating patients with chronic pain. I often see folks who have tried a lot of traditional methods, and they kind of, often say they've looked on their own. They've searched for relief, and finally they make their way here, which we're trying to change that, so it's more of not a last resort, but a first choice.
Yeah, for sure.
Yeah, and I also treat pelvic health conditions and concerns. I specialize in a technique called Myofascial Release, and it's something that I, as a physical therapist, can do, but OTs can get certified in it, as well as even speech therapists, believe it or not.
Well, the fascial is everywhere in the body. So when you really think about it, and that's really one of the reasons why I wanted you on the show, is because as a certified hand therapist, we deal with a lot of people with chronic pain. Like I just taught on CRPS, which is a chronic pain type of issue. The majority of the cases tend to be like post-distal radius fractures, but you can have CRPS on any part of your body that has a fracture, has an injury, or anything like that.
Absolutely.
And so one of the things that I wanted to do also was I wanted you to come on and kind of tell a little bit more about your specific technique, but potentially even share with the therapists who watch, like something that they could use right away.
Absolutely. I'd be happy
And it could be in any part. Like it doesn't have to be the hand. It could be, something with the neck or the shoulder, the elbow, something that the therapists who are looking and watching and want to learn, that they could almost take back and use right away.
100%. I would be happy to. And one of the best ways to learn is to treat yourself. So I have thought of a few good things to share with all of your listeners and followers. So we'll definitely go into that. And to get to your first question about what is myofascial release, fascia, like you said, is basically what we're made of. It's about 70% of what makes up our body, and it lays over muscle. It's the first layer. If you can all see the orange behind me, that's kind of how I explain it to my patients. Might be a good analogy for everybody listening.
I always wondered what was up with your
I know. So
logo. And how do you even say the name of your company, like your physical therapy clinic?
So the Italian way would be Arancia, but I say Arancia. It's easier for people to understand. And it means orange in Italian. I'm Italian, so I had to throw that in there.
You're 100% Italian?
No, 3/4.
Okay.
I don't French side.
Good enough. My greatest friends are Italian,
Absolutely. Got it.
From Italy.
I like to have easy ways for patients to understand things and break it down simply.
Yeah. Okay. So, the segments of an orange is how you.
Yeah. So basically, if you think of like that clear layer that covers each slice, That's how I explain the top layer that lays over muscle, like a piece of chicken even. The clear
Yeah.
layer that's over that, the casing over
Orange
it,
sounds so much nicer.
right? So if you think of that clear layer, it's kind of like that superficial layer of tissue
Yes.
body, but it goes all the way down to the depth of our body, is also known as the ground substance. But if you think of it as orange, that outer white hard layer that's dried out, that's like the deepest layer of our body, which gets solidified over time as it's depleted of the hydration that we're made of, water. And so if you think of different things in life, like maybe patients come to hand therapists after surgery or a fall or trauma,
And they're like,
yeah, that layer all the way down to the cell level gets very gunky and dried out. So,
yes.
myofascial release can help restore the natural fluidity of the tissue and bring back the gelatinous layer, that fluid layer of tissue, so that when we move, it's not painful and we don't have tightness and tension, but it's more fluid in nature, because that's largely what we're made of, as well as water. But we can't just drink it back. We can't,
Yeah.
be
Do
like,
you still tell your patients to drink water though?
it's good. It's, water is awesome to drink, but when you have these, it's not the cure for the restrictions. It's gonna just be like pouring water over a rock. It'll just slake right off the surface, because we have all these tight, gnarly restrictions get away, and it's, solidifies our system. So when we do authentic fascial release, it helps to open up the space in between. It's also known as the interstitia. So that connective web starts to have space. So as you drink, the water will permeate through down to the cell level and really restore us at such a deeper level. So fascial release is a wonderful tool to add to your treatment program, to really understand that it is the only system to touch all the other systems in the body, which is really cool to think about. So it lays over muscles, so you can't really have full strength of the muscle if you have fascial restrictions that lay over it. Lays over the nervous system. So even just
I'm a huge nerve person.
Yeah, so think of a fascial restriction in the neck and shoulder area, right? Maybe like behind that scapular.
Yes.
It can equate to up to 2,000 pounds of pressure per square inch on any pain sensitive structure. So crushing pain, that's like 2 horses on your shoulder. Imagine all the nerves laying under there, just hyper excited because you have this nasty, gnarly fascial restriction laying over it, which in turn is affecting your hand and causing you to drop things, right?
Yeah.
And we might think like, oh, your hand is so weak, like let's address the hand right away. But what about this gnarly restriction up here that's putting so much pressure on the nerves and muscles that then cause you to drop things?
Right.
So it's really teaching therapists to look for the symptoms, but we want to look deeper for the cause. We can treat the symptoms, we want to look elsewhere for the root cause. And it's really neat in terms of muscles and the origin and insertion of things, when we know from our training in school that we have to memorize everything, or all the origins, insertions, actions. But when it comes to tissue, it's a unanimous web from head to toe. So we talk more in terms of regions, because a shoulder restriction, it's not going to be necessarily on one part of the shoulder. It's going to be global. It's going to affect the neck, the shoulder, the wrist, probably all the way down.
It's
impossible to pinpoint a specific nugget of tissue, you know what I mean? It's a huge effect on the whole system.
When people find you, are they looking for a specific technique, or are they aware that you do myofascial, or are they just coming to you because they have chronic pain?
So it's a little split right now. A lot of patients find me organically on their own because they want a holistic approach and they want to find relief, but not short term. They want long-term lasting relief. So those are the folks that kind of search me and find me on their own. But then I have another pocket of therapists, or patients rather, that find me on a therapist directory that just specializes in this approach. And they come and say, hey, I know you do this. I just want this. I know it's for me. So there's, kind of 2 different types of patients, but they're all in chronic pain.
Yeah, so it's very similar to how people will find occupational therapists who are certified hand therapists. If you become a certified hand therapist, you go into a database.
Right.
But we certified hand therapists tend to be known for post-surgical stuff.
Okay.
They tend to be sought after for post-surgical stuff. And I'm a huge believer in, like I did a video, I think, talking about like the piece of the pie. Like most of the time, there's people who have injuries, they fall, they need surgery and stuff like that. And that's just one piece of the pie, but there's all these other people that have chronic types of issues, and they just, if they keep going to a very traditional base mill of a clinic, they're not necessarily getting someone who's going to look at everything and dissect it from those levels.
Absolutely.
So you guys, like as someone who's myofascial specialized, you have a database too. And that's how people...
You know, you don't have to be on it, but I would highly recommend being on it because it's one of the things that distinguishes, you know, what you do. And just like you said, a patient just had surgery. OTs are in an amazing position to do some, you know, really different techniques that people might not understand or think of as a, you know, OT, but this is the thing, like
yeah, and it's not OT, PT, it's like I want to help someone to become more independent, to live a certain lifestyle without pain. So I cater to, it's funny, I say I cater to an older population, 40 plus, but actually we get a ton of young people, and we got a ton of young people with nerve types of issues. We deal with a lot of nerve entrapment. Actually have someone who came in. She actually came to me a year ago. And she was very much like, I want to do everything on my own. She kind of wanted to do a one-time thing, and that was it, right? But she came back recently, and she has numbness in her thumbs. And so, you know, I just had taught on the different nerves. And so I was able to rule out all their nerve issues. I was able to rule out carpal tunnel issues. And I knew from the thumb that it was a radial nerve type of issue. But she was so restricted, and I couldn't pinpoint. She had neck, shoulder, and thumb, and she doesn't have pain, right? So sometimes we use the word pain, but they're just uncomfortable.
Right.
It feels really tight all the time. And she had very specific numbness. And I was like, okay, like I knew it was a radial nerve type of issue. And this is how she would be. She was like, if I bite my thumb, feel it normal here, and I do it on this side, it's numb. So I told her, you know, like, yeah, we got to find out where it is.
Getting entrapped, you know,
what's entrapped, where it was. And one of the hardest things is that they have to understand it's not one visit.
Right. And I love that you're highlighting that, because for anybody, especially the new grads who might feel that pressure to get somebody, you know, finished with their plan of care quick,
Yeah, yes.
you know, you're feeling it, but you have to remember and really do your part to educate your patients and let them know that this didn't happen yesterday. It's not going to get fixed overnight. And if you do want a quick fix, you might not be in the right place because you're not in the quick fixes.
Yeah. Do you often also tell them that it probably predated when they started to feel it?
Oh yeah, because it's literally like what I always explain to my patients is what they come in for is usually like the needle that, you know, threw them over the edge. It's literally
right. The needle that broke the camel, the hay, whatever. What's it say? I can't come up with a saying right now, but you know what I'm talking about.
So it's usually, you know, you have to peel away the layers. And I like to use the layer analogy again, because what they feel when they first come to you is the last straw. And they forget because they've numbed it out in the beginning. They've kind of pushed through it. No offense, but men, a lot of times men kind of mask it, or they, you know, they think, you know, it's it's going to get better the next day. They can kind of bull through it. And that's just not, the pain is your body's sensation to withdraw. So when you feel something that's less than pleasant, it's a signal that your body is trying to tell you,
Right.
you know, you have to listen to that. Otherwise, you know, you wake up and
Yeah.
everything hurts and you don't understand why.
What do you say to people when do they come into you for numbness, or do they come into you for sensory disturbances, or do they just come to you for pain?
All sorts of things. I've got patients who have, you know, numbness. I have patients that,
So what do you say about the numbness? What do you say to them when it comes to like numbness stuff?
Same thing is we have to sort of detect where it's all originating from. So we're peeling away the layers. We're figuring out, like you mentioned, if it's the thumb, if it is radial nerve root, or for me, my first, you know, thought was, okay, she probably has several anterior transverse processes that are rotated. We have to take the snags out there. A lot of therapists forget the front of the back, and it kills me, but they always go for the back. You have to get in the front because this is the area that's getting short and tight.
I want to hear this, because so see how, I mean, we're getting to the same thing, right? We know it's not from the hand, but our approaches are completely different. But so, and I was working her neck, so but she was definitely entrapped in her thumb. But I want you to tell me your anterior approach. Share that with us.
Yeah, so after I've done a full posture assessment, what I do is I take a view on my iPad in 4 different ways. I review it with the patient, and then we agree together, hey, here's where it's probably coming from. So after, and I want to just say this, after I've balanced the pelvis, then I work my way up to the neck and the thoracic. I clear the thoracic diaphragm, and then I go higher up. So if I'm looking for that nerve root specific, and I'm going to use my thumbs, and I can check on myself first, but I'll go, you know, right behind SCM posterior to it. I'm feeling on the patient when they're laying down on their back, each one, and I'm feeling for the heads of those transverse processes. What I want to do is I want to feel which side is higher, you know, the right side or the left side, and usually you can tell by the pelvis, they mimic the pelvic alignment. And so it's so easy once you kind of soften your focus with the postural assessment to get a sense of what side might be rotated in the neck, which affects everything distally in the shoulder and arm and hand. But when I'm feeling for those snags and rotations, the thing that I don't ever want to do is force them back to being neutral again. I'll go in the direction that, of course, this is all through training that you learn in the Barnes of Myofascial Approach, but we're going in the direction that it's already going first. Because if you think of a stuck drawer, sometimes it's helpful to push into that stuckness up. And that's what we do with the body. We never go abruptly against the direction it's already going, but once we held it in the direction, you know, let's say it's rotated anteriorly, we're going to go in that direction and wait. We'll go into the opposite direction, and it eases up so much faster and longer lasting because we didn't force. If you force, it's such a tender area anyways. We'll brace, and then that's going to prevent you from doing anything. Be on guard.
It's the same idea of like you're pushing into pain, you're gonna just get more pain and a fear of that pain and guarding. So you're actually pushing into an area that feels good for somebody.
Your body's already doing that, so
and then it's gonna relax, and then you could pull it out of that pain.
You really kind of, like I was saying, to try things on yourself. If you go back right by where the mastoid process is, I just take, you know, 2 fingers like this, and I go right behind. And I first go inward. You can feel that space there, that it's kind of like a squishy space. Go in, and that's kind of like where we have 13 different neck muscles that attach on either side. It's a really therapeutic release for people and on ourselves. But what I do is I trace all the way down. So I'll come all the way down the front of the neck. And you have to be careful. Obviously, the SCM is there.
Yours just sticks straight out. Where is mine? I fixed that shit, and now it's still
So for all the you know, viewers, just turn your neck and you'll be able to feel that SCM kind of jut out, and go right behind that, find up to the mastoid process, and you really want to just glide down. Think of them as like 2 escalators, and you're just kind of gliding down, and you're feeling where you get stuck. Right here. So I'm going to wait there and be gentle, but you're gently compressing in, and slowly your hands will go down on their own when the tissue releases. But it's a really great way to open up the front of the neck. And the more important thing is you're assessing what tissue, is stuck and what needs to be released so that you can go back to it and find the snag with the transverse process.
So the terminology you use is a very Mulligan.
I've sort of.
Right? Do you do Mulligan too?
I have taken Mulligan courses, but I sort of kind of blend the terms, and I shouldn't do that. But
no, but you can. But I just find that there's certain pockets of people. I've been a therapist for a long time, so I've taken on a lot of different courses. But it's funny because when you're a new grad, and I remember being a new grad, like you're just so overwhelmed with so many things, right? But then after a while you start taking it and you're just trying, like for me, I try to find a lot of commonalities and stuff. And I find that you just find the approach that you like just naturally gravitate toward.
Absolutely.
And then you'll see that certain things are just very similar. Like so the myofascial stuff is again moving into the good side. So I'm a total motion release person. Like I don't know if you've seen the TMR stuff, but they do more active stuff, but they always do the, move into the yummy side, move into the good side. And there's a lot of things that talk about that. A lot of different techniques that talk about moving into the good part, moving into the side, the area that doesn't hurt,
right?
The release side that does hurt. So it's very similar in the myofascial aspects, right?
Or, in that respect of, not wanting to go directly onto a pain-sensitive area, if you can address the areas around any painful structure, it's going to help that painful structure. It's going to help loosen that indirectly. If you can always start with an indirect technique, the patient will feel more trusting in you and more relaxed, and it'll help desensitize the other tissue. Now, let's say you mentioned CRPS. Let's say you had somebody like that who you can't even go near them sometimes. Have a patient who was bit by a dog and got it. So I wouldn't touch that side, right? I would always work on the opposite side, balance the pelvis, and finally now we can work above and below on that where the bite was.
Right.
She's slowly getting, confident, putting that foot down on the ground, and she's made tons of progress, but it's not like an overnight thing because it's millimeters a day to regenerate.
Yeah.
But the more you can teach them to do on their own, the better they're going to get there.
Yeah, no, absolutely. Absolutely. Very cool. Well, that's nice. I think people are going to be able to do something specific with what you showed. My lady,
back to that real quick, because there's one more thing that you can do in addition to that nerve patient for herself. So I'll just turn my camera down a little bit, and this is a really great wrist extension shearing technique. So if you can the wrist, and it's also great for the desk workers, typers, or even people that are on their phones a lot, is that you want to open the wrist this way. And what I usually have people do is, if they're in a sitting position, I'll just I'll stand like I'm sitting, but I'll have them sort of rest their elbow on their knee this way, their hip, and I'll have them open up palm on palm, but so you can see you're getting into that carpal tunnel. And the retinaculum is there, that thick band that lays over the nerve. So you're opening up, but what you do is, the reason why it's hand in hand, you're compressing first, and then without sliding or gliding, the direction's going down, but you're maintaining contact is the stretch piece. The difference between myofascial release and most therapies is that we're not using any sliding or gliding. It's constant compression, stretch combined, but without any like movement like this.
Okay.
Really
okay. How much pressure? Because I always hear my stuff as being very light.
Okay, I'm really glad you asked that, because this is a misconception and I want to clear it up for anybody listening.
Tell us.
Authentic myofascial release, I'm talking about the John Barnes approach, is 20 millimeters of mercury. So we don't want to do 5, we want to do 20 pounds of pressure per square inch, because if you're under that, it's very like surface gelatinous.
Yeah, it's not enough.
It's like similar to there's another gentleman's approach, the craniosacral approach. You know, his is very light and it's still good. It's just that this approach goes down to the depth layer, and we all as individuals have a different depth barrier. And what I mean by that is, you know, for you, let's say I treated your shoulder, and what I would do is compress down into the shoulder, and I would wait until I feel a natural stop. Think of like your hand sinking into sand, and you feel that natural stop. We don't want to make you brace and tighten, but where we feel like there's no more room to go, that's where we hold the depth. And then we apply the stretch at the same time. And the time is another huge component. It needs to be a minimum of 5 minutes or more. And within that time, that's when interleukin 8 is released from your body, which is your body's natural anti-inflammatory releaser. So instead of having, you know, pain pills and anti-inflammatory, you're going to have your body release it naturally. And it's a phase transition basically that happens after about 90 seconds. It's called piezoelectricity, so pressure electricity that happens, which kickstarts the next phase where your body starts to open up that interstitial web. So as that web is opening, your hands, and you can kind of sense the tissue softening, but that's kind of like the fool's gold. That's where most people would give up. You want to maintain that compression for at least 5 minutes, really, so their body can have that interleukin 8 released. And that's the best thing that could happen to help you.
So it's a sustained pressure, basically. So there's not a lot of like, oh, let me move all over the place, let me push and pull.
And that's something that's really important for the therapist listening to know, because we all want to be doing something, but
it's that sensation of I'm doing a lot. But you can do a lot with doing very little.
You're doing so much, and the best thing you could do is really take a class. If you go to the website myofascialrelease.com, you'll see them there, but it teaches you how to really be patient and help better teach you how to feel. Because if we're talking, if we're, you know, trying to keep the patient entertained, we can't fully focus on what we're feeling, for one, and they're not either. Even though they might say they are, there's no way they can. So it really teaches us to sort of understand what's going on left brain and explain that to them, and then when they're trust, but then turn the right brain back on even more, you know, and help to soften it into what you feel, so that you can be more perceptive on those subtle releases in the fascia, and you know, also see where the rest of their body is responding. Because another thing that happens is just pretty cool is a vasomotor reaction where blood comes to the surface, right? So on a region, the rest of the body can light up. For an example, I had a patient who came to me for chronic back pain. I was doing a lumbosacral decompression, and all this area got beet red. I could feel the heat. I could see the heat. I didn't say you're right, bright red, but later on, she dialogued more with me, and she revealed that she had a trauma and she was, you know, abused, and there was more to the history that didn't automatically come up. So you always have to have your, you know, scanning eyes on, because there's things that we can't see over clothes. It's great to have like a tank top on or shorts so you can really see the skin. Patients aren't going to always come out and tell you these things, but it makes a big difference with the treatment approach, because if it's a chronic pain patient especially, these emotional holding patterns can strain us physically. And we don't mean for them to, but it's the mind-body connection that we also need to kind of be aware of for a chronic pain patient.
Yeah, cool. So what I'm going to do for this video, I'm going to include your link can I include your link of your company, like of your website? That way, you know, if where are you located again?
We're located in Cranston, Rhode Island.
Okay, there you go. So if there's any occupational therapists or physical therapists or wanting to reach out to learn more about myofascial, they could come to you. And do you have a YouTube channel?
We do have a YouTube channel right now. It's Arancia Physical Therapy. You can find it on there. Our website's aranciaphysicaltherapy.com. We're on Facebook, Instagram. Awesome. You can find the book on Amazon.
Yes, show me your book.
Yes, this is the book, Conquering Mystery Pain, How Myofascial Release Can Help Heal You. And This is a really cool book because you can flip around. You don't have to go in order. You can find a diagnosis that interests you, or there's also 10 therapists, some of my closest colleagues that share their stories in here, as well as 6 or 7 of my own patient stories, a lot of science. I made sure to beef it up with the research. So I think something for everybody. You know, there's 2 great OTs in here. So
yay. I find that a lot of OTs are going into, so you said you do a certain amount of pelvic health, and I find that so OTs have always done for the longest time bowel and bladder types of issues. So they've always spoken about pelvic health, but in a more functional way. And I think it's kind of like not as sexy to talk about bowel and bladder. But OTs have always spoken about it and treat it in a very specific way. But it's all relatively related. But now they've I'm noticing more and more OTs going into like that pelvic health type of issue, because it is beyond bowel and bladder, because they OTs talk about sex and stuff like that too, but pelvic health is a little bit more all inclusive of that.
And as an OT, you really can do everything a PT can. It's really like a label that is a little limiting, I think.
It's a kind of an approach, but I think you can then, just like in the realm of PT, you can go myofascial, or you can go McKenzie, Mulligan. OTs do the same thing. You can go more neuro-based, geriatric-based, hand-based, but all of those types of techniques are still there. But I really love myofascial. Are you doing something specific to kind of teach more and more new grads and OTs and PTs in that realm of your style? Because I mean, you know, you can be a hand therapist, but I'm out there teaching people like my style and everything I've kind of put together, and my approach to things, and my critical thinking of thinking through problems. And I think there's a lot of need for that.
Absolutely. I'm glad you asked that, because I do have a course that's going to be launching soon within the next few months. And we'll have a separate YouTube channel just for that course. And it's for students, current therapists, to learn about the Myofascial Release approach. I won't be teaching, you know, the techniques in particular, but it'll be more about the theory, the science behind it, what type of population will benefit from it, some self-care techniques for therapists as well as students. A lot of yummy things that I haven't mentioned are going to be in there too, but it's going to be a way to tie in what you already know as physical therapy and make it more honed in on getting a patient the outcome that they really want.
Yeah.
It's not just a tool. It's really like how to use it for the outcome. And so it really helps in the evaluation sequence, and then the plan of care, and all the way to the end result of they don't need to rely on you anymore, but they come in for, let's say, a tune-up. And we should do that.
I love me some tune-ups. Working people who just come in because they want to make sure things work well.
Yeah, you have one house.
That's a whole nother topic, girl. I can get into that, but I know you got to go. I really appreciate your time. And what I'm going to do is in the description below of this video, I'm going to include all your info. And I cannot wait to take your class myself, because I want to know. I want to learn from you. And as soon as you get that out, I will pass it along to all my readership people who are in my program now. So I'm really excited.
I'm so excited, and thank you so much for having me on here. I look forward to getting this course out there for all you guys.
Cool. Thanks. All right. Thank you so much. We'll talk soon.
Thanks, Wong.